Oh, wow. Okay. I had it turned up all the way. Okay, I can hear you now. Okay, good.
Great.
All right. Sorry
Okay.
about that.
Great. Don't worry, don't worry. This, it never goes too smoothly with the lives.
It's fine.
Hi, everyone. Thanks for joining. I see a few people joining here. I'll say hello.
Hey, Colin.
Oh,
Let's see,
thanks for
Colin.
thanks for taking
And
time out of your busy day. I know you're right in the middle of your work day. It's evening time here, and it's a bank holiday Monday, so just
oh,
relaxing this
nice.
evening. So
Yeah, that's nice.
that's nice. So I'll get you to just give for anyone that doesn't know you yet. If you want to just introduce yourself and then we can talk a bit about motor point acupuncture, which is why I brought you on today. So
Well, my name is
when you're ready.
Rich Hazel, and um, what can I tell you? I'm in Buffalo, New York now. I was in New York City, and you can hear my dog barking. Sorry.
I
And
can. Hi, doggos.
and uh, I've been teaching motor point acupuncture for I think since about 2016, if not late 2015. Um, and I happen to be working out of the same office as Dan Dominguez, who was one of the first people that I ever taught any motor points to, and that was in I think late 2015. And if anyone's been to our seminars, you probably met Dan because he assists me a lot for the bigger seminars. Um, what can I tell you? I started learning motor points at Pacific College when I was learning TCM acupuncture, and just seeing how powerful it was for relieving pain. In fact, it's it's really what fixed my back pain was learning the motor points with other students and needling each other, and it fixed the back pain that nothing else had fixed. And I think at that moment, I knew that was what I wanted to do with my practice when I finished and got my license, that I wanted to focus entirely on treating pain and improving mobility and improving sports performance. So I had a lot of information that I needed to learn even after graduating, just to fill in the gaps on orthopedic assessment and functional assessment and sports medicine, um, all of the different styles of electric stim acupuncture, like through McMaster, the neurofunctional style, and the things like what Dr. Joseph Wong was doing, what C. Chan Gunn was doing. Dr. Gunn and Janet Travell's work were the first things that I really dug into after school. Dr. Travell, if you know trigger points and pain referral patterns, she learned a lot from Dr. Kellgren, and she kind of expanded on his work on pain referral patterns and trigger points. So really, just I just have had to keep learning, and I didn't really intend on teaching, but after I did that free class, I really did the free class really for selfish reasons. Um, when I graduated school, I knew that I wanted a group that I could bring my complex patients to and talk about what was going on and try to get advice on how best to address the situation. And what I found was there was really zero for me. There were no acupuncture groups that I could join that talked about motor points. So there was really just nothing. And I had reached out to the people who were teaching motor points, and I got like zero response from them. Not even an email back saying check this out or try nothing. I got zero. So
Yeah.
I
Wow.
I kind of selfishly decided to join what's now called Chinese Medicine That Works. They were at the time called Acupuncture That Works, and it was mostly they were doing distal and trigger points. So trigger points were part of what I did. So I said at least I've got people who recognize the value of treating locally for pain. So I kind of, got in that group and started talking about motor points, and there was definitely an interest in what the difference was and how you use them and what you could do. So I agreed to teach a free course with the guys from Chinese Medicine That Works. I went up to Albany and 8 people showed up and I demonstrated motor points. And really everyone there grasped it, took it home, used it, and started talking within the Facebook group about what they were doing with motor points. And it just sort of took off from there. Um,
Okay, yeah.
and then I started teaching. So,
It's yeah. I first trained with you I think 3 years ago, and I know I've attended a few of your courses, but yeah, I have to say, like that, like you said, it was the only thing that helped your pain. It was motor points has been the only thing that ever went close to fixing my shoulder. Now I have to get more again, but yeah, it definitely works. It definitely really works. I'm getting hoarse here. What am I talking? But yeah, but like right through as well, and your trainings have changed as changed and evolved over the years as well, which is why it's been great for me to attend a few different ones and keep learning. But how applicable it is as well back in the clinic as well. The very next day, yeah, it's been really great, and
right.
that's
I
like you
mean,
say, with
the,
all your students find the
the,
same
mo- the, the motor points work so well that even with basic knowledge, you can get some really great results.
for
The
sure.
the
Yeah,
ongoing
for
the
sure.
ongoing training is because you're going to run into that 10 to 20% of complex pain where you need a little bit more knowledge than the basics. So that's where I'm
Exactly.
always learning. Every time I've had a really complex pain patient, I've learned something. And that's why what I teach continues to evolve because as I've learned and I've had to learn in the clinic, and on one hand, I love self-teaching. I'm always learning. I have a Dutch lesson later today. I'm always teaching myself something. I like to self-teach. So on one level, I'm always going to want to study everything that I'm passionate about. But on the other hand, I think now that I'm teaching, I always want to bring something fresh and interesting, a new approach, because, it gets old if I just teach the very same thing over and over and over. It would be boring to me. It would be like telling the same joke twice. I don't like even telling the same joke twice. Never mind. And you'll know if you come to my courses, I don't really talk from cue cards. I just have to talk sort of from the bullet points and then expand upon it because I want it to be fresh for me and I want it to be fresh for everyone else. And I just I don't like, well, nobody wants to see a lecture where they're reading the lecture, but I
No.
really just feel like it's important based on feedback I'm getting from the room to adapt everything I'm saying to the room and to address the concerns or questions from the room based on things that people want to talk about. So, hopefully my courses continue to evolve and improve, and all of that comes from clinical experience, really.
For sure, for sure. Have you been we were talking recently, it was actually, you brought it up a couple of months ago about headaches and migraines, that you were seeing a lot of it in clinic, and it was so
Yes,
interesting to me because the exact same thing here, the other side of the Atlantic, it was the exact same thing was happening. So
yeah,
we were finding getting great results we were finding that it was all to do with, there was a lot of tension in the neck. The tension of this last year
absolutely,
had all worked its way
absolutely.
into the neck. So it
Yeah,
was,
yeah.
yeah, it was interesting. And are you
I
still seeing
just
a lot of that at the minute?
I'm still getting lots of referrals from people who with headaches, migraines, referring the
Yeah,
other people that they know who get migraines. And I got
yeah,
to say, motor points with electric stimulation and trigger points, primarily of things like the upper trapezius and the levator scap and the semispinalis capitis, makes a huge, huge improvement for people who get migraines that are triggered by tension headache. And that's a lot of
yeah.
people. But I just had a
It is
guy,
a
very
lot.
interesting. I had a really interesting case. The guy came in um, with a constant headache that he had had since his second COVID shot. So after,
Oh,
so
wow.
he said he had had
Interesting.
10 days, he had had 10 days without a headache, but he basically had a constant headache for 2 months. And, and it
Wow.
was even worse. It would tip into a migraine if he had any sort of alcohol. So he was pretty miserable. Um,
I'd
and
say.
long story short, the first treatment resolved the headache, and he came back to me the next week and had not had a headache all week, and was able to drink alcohol. And then of
Okay.
course
Results.
yeah, so I'm seeing him again this
Yeah.
week for his second treatment, or his third treatment. But I expect it to either be the same or continue to, continue to be the same or even better. Um, because he had an interesting history of head trauma that had kicked off his migraines 10 years previous. And it seems like many people, I think, are probably seeing the same thing. COVID or the COVID shot has some sort of inflammatory process that seems to flare up in the areas of previous injury for some people. So I actually had an
Okay.
anesthesiologist who had a knee surgery about 8 or 10 years ago, and after her second shot, that knee flared up for a couple days
Isn't
of
that
pain.
really interesting? Yeah.
Yeah,
That it
it's an
seems to
interesting thing.
find the
COVID
points
COVID will
that
find your
have.
injury and flare it for
Yeah.
sure. So even
This.
the
Yeah.
even the vaccine is doing that for some people. Um,
Yeah.
so I think that's really what happened. He had this underlying pattern of muscle tension, and the COVID shot inflammation was just enough to tip him over into constant headache.
Wow. But like you say as well, so he's better now, and it's the way we always work is that they'll come in and they have an improvement, and then might see them once or twice after that, and then we'd only see them every now and then to make sure they don't go back to being in pain or having a migraine, and then we might not see them for a long time as well, and
Right.
they stay pain free,
Well,
so it
I
works.
will say I will say if I see a daily migrainer, they're not going to get such great results in one visit. They're going to feel better after one visit.
No,
They're going to have
no.
fewer headaches, but I would guess the daily migraine patient needs to see me once a week for a few months before they
Oh, for
can really
sure.
start
It's yeah.
spreading out their treatments.
Yeah.
That's a really tricky one, and I would
Yeah.
say that's a
It's
longer
it's
commitment than most problems. Even low back pain doesn't
it
usually
is.
require that kind of commitment unless they're old, really
Yeah.
older.
Yeah. I mean, you've people, yeah, you do have people that are suffering much like they have a much more complex history and they're suffering for a much longer time with migraines and, having to take days at a time off work, having to shut themselves away. So yeah,
Yeah.
I'd be including the traditional Chinese acupuncture points for that as well. So getting the complete history. So it's a bit different, a different approach as well for that. But yeah, I'm conscious of your time here as well, so we'll try and talk about anything else, and then I'll let you get back to your day. What else did
Okay.
we want to talk
We were
about?
talking
We could
about
talk about shoulder.
like, yeah, shoulder pain or low back pain, neck pain. I see it a lot of all of those. Um, so,
Yeah,
they're and they're
it's the same.
everyone is unique, and yet injuries sort of rhyme with each other. You see the same sorts of patterns for people over and over. And the more clinical experience you get looking at things more from an orthopedic lens, the more likely you're going to spot something very quickly that you've seen many, many times before. And it speeds up your results so fast to be able to go straight to what you think it is, maybe do some testing and just to check or ask some questions to see if you're right, and then just go right at it. Your results are very fast when you have that sort of clinical experience. Um, much like any style of acupuncture, I suppose, the more
Sure.
experience you have, the faster you are at getting to the right diagnosis. Um, but
Yeah, that is,
but
that's for sure.
but just learning the basics with motor points, you can do a lot. There were times when I first graduated that I really didn't know a whole lot about what I was doing with some tough cases, but just sort of following my intuition and treating the muscles that crossed the joint that was having a problem would get me a very, long way down the path. Um, with complex issues, you tend to see good results that don't completely resolve if you don't really know enough to find that instability or that trigger point that's just keeping them coming back. So, you
Yeah.
know, it takes time. It takes time, but like I said, even at a basic level, you can do a lot of good. And often accidentally resolve some people in like one treatment. Um, you just don't, you don't always know how people are going to respond, but sometimes they get way, way better after one treatment for something that you didn't expect to get better until the third or fourth visit. So,
I, yeah, I find that quite often for sure. So I'm very glad to have had this training with you, and I'm sure you're looking forward to getting back to traveling to teach again. I know that's one of your
definitely.
favorite parts about your work.
It really is. It is my favorite thing.
Yeah,
Yeah. I don't know. I'm talking to someone in Poland um, about maybe
yeah,
something at the end of this year. I see the talk on the news about the EU wanting the US to be able to come back. So now, whether that means that people in the EU and England or UK, I should say, are able to then cross borders to come to a seminar, I don't know. But
yeah.
I'm
It's
hopeful.
yeah.
I'm hopeful we're coming up to a time where we'll all have a little more freedom to travel without quarantine, and that would be great. I would definitely love
Wouldn't
to do
it?
something with, yeah, like we could definitely do something where everybody is vaccinated, and then we can all feel comfortable and safe around each
Exactly,
other
exactly.
and be like old times.
I know. I look forward to that for
Me
sure.
too.
Yeah, I
Yeah.
know
Yeah.
it's been challenging. And
Yeah.
have you settled to your new location? You're quite settled there
Oh yeah.
now.
Yeah,
Yeah,
I'm starting to feel a lot more at home here, and yeah, and I'm busy at work. Thanks to Dan having a very high visibility. Like I
yeah,
get tons of people who come just to because they've heard about the clinic itself, and
yeah.
so I've been busy from the beginning, and very grateful
Great.
to be able to do that
That's
because it's super rare to start over and be busy.
isn't it? I know, I
Yeah,
know.
yeah,
But yeah, you have a good person to work alongside as well. And
yes.
whenever you're back teaching, I'm sure you'll have Dan at your side again.
Yeah, he better be.
Yeah.
Yeah,
Unless
yeah.
he's too busy.
Right, right.
Yeah. But and what else? What
Well,
else
I
were
would
we going
just
to talk
say,
about?
for people who are following you, I would just say, if you've been hesitant to try acupuncture, definitely come in and see Helen and see what it's like and realize that it's not uncomfortable. It can be a little strange when your muscles move with the electric stimulation,
I get,
but strange is not pain. It's just a
I,
little
I get,
weird.
I get told it's weird. Myself and Nicola, I know you watched myself and Nicola's talk, and Nicola demonstrated, and we were talking about what people say. Oh, it's a bit weird. It can be zappy,
Right.
but we always the always the main thing is like if it's not comfortable, then you have to tell us because it's got to be comfortable for you to be most effective. And it's the same when we're doing dry needling, when we're treating trigger points, we try not to
Hmm.
cause too much discomfort. We go a little bit more cautiously than some
Right.
others,
Right.
depending on,
But
yeah.
I would
So
say it's no more uncomfortable than a deep tissue massage. And I actually think
It.
some deep tissue massage I've had has been way more uncomfortable to me than
Yeah,
trigger point dry needling or especially motor points. I think motor points are pretty gentle. Um,
they are. They are.
so if people are thinking about it, they should definitely try to find someone
Yeah.
near
If they're
them
in
who
pain,
uses motor points. Yes, it's
yeah,
even
yeah,
if it's milliseconds of a little bit of discomfort just because you're
discomfort.
uncomfortable, it's you're trading in all of those days of pain for like just a few, you know, uncomfortable moments, and then you
Mm,
get to live your life with much less pain. I don't know who wouldn't do that.
exactly. Exactly. Yeah. Yeah. That's exactly. That's a great point. And thank you so much for joining me and taking time out of your
Yeah,
busy
thanks for
day.
having
I
me.
know you're in the middle of your working day, but that's great. And I'll definitely be speaking to you soon anyway. All
Okay.
right. So
All right,
I'll
great. I'll
goodbye.
see you on Instagram.
Thanks, Rich. See,
All
see
right,
you
have a good
there.
one.
Bye.
Take
Have a
care.
great day.
Bye. All right, thanks.
Bye.